Hi, everybody. Good morning again, and to those who weren't here earlier, you are most welcome. I'm Mary Woolley. I'm the President and CEO of Research America. We're so pleased to have you with us today for our National Health Research Forum. We're going to have spectacular people on issues, talking about the issues of today. You know, the name of this forum is Straight Talk, and you will hear that. And you will have an opportunity, too, to ask your questions, so keep that in mind. I am welcoming you on behalf of my colleagues on staff and our board. So if you would wave your hand or stand up, if you're a board member or staffer, wave your hand, stand up. I see you out there. Thank you all for your partnership and your hard work. And to those of you who aren't in the room, thank you for joining us on live stream. And for everybody, please join the conversation on Twitter, on social media, hashtag RAForum19, RAForum19. This year's program, New Thinking on Persistent Challenges, is particularly relevant for us, we think, since this is our 30th anniversary year. We've been persistent, and problems are persistent too. Some more so than others. There's a lot of progress has been made, and we'll hear about that, a little of that in our Then, Now, and Imagine panel. But we're going to focus on the future, on the difference we hope to make in the next 30 years. And that's not just us, but all of us working together. Our mission at Research America is to make the case for science and innovation in both the public and private sector, because making that case because science and innovation save lives. They help restore health, prevent disease and disability, strengthen the economy, and propel scientific and societal progress. Supporting the efforts of people in labs and clinics, working at computers, working with huge populations of data, or working one-on-one. Supporting your efforts is a privilege for us that we take very seriously. As I noted, this year marks our 30th anniversary, and I do want to thank you, our Alliance members, and all of you who are joining us for your partnership and your commitment to a nation and a world made better by medical progress, by public health progress, and by scientific progress. Before we begin our panels, I want to extend a special thank you to our sponsors. Excuse the paperwork, usually at a podium. Our lead sponsor is Pfizer, and thank you so much, Pfizer, for your long-standing support. Our panel supporters are AdvaMed, the Association of American Medical Colleges, or the AAMC, BD, Elsevier, Johnson & Johnson Innovation, PCORI, the Patient-Centered Outcomes Research Institute, Regeneron, Sanofi, and Takeda Pharmaceutical Company Limited. Our breakfast sponsor was Horizon Therapeutics. Our lunch sponsor is Celgene. Event sponsor is Eli Lilly and Company. Science sponsors are the American Association of Colleges of Pharmacy, Astellas, and Bristol Myers Squibb. Thank you all. Please join me in a round of applause for all of these great partners. Okay. Now, it's a special privilege, and boy, I got to tell you, this feels really good to be kicking off our first panel. A panel of women leaders are leading us off today. I think nothing could be better, really. I know we're going to hear insights and suggestions, and everybody's going to be very energized. So please welcome, first of all, and I think they're coming in from this side, Dr. Jenny Colombo, the Vice President of Global Patients and Scientific Affairs at Takeda Pharmaceuticals. Michele Oshman, the Director, Federal Advocacy and Alliance Development at Eli Lilly. Dr. Gwen Nichols, the Chief Medical Officer at the Leukemia and Lymphoma Society. Dr. Erin O'Shea, President of the Howard Hughes Medical Institute. Dr. Peggy Hamburg, the Foreign Secretary of the National Academy of Medicine and former Commissioner of the FDA. And Dr. Janine Austin Clayton, Director of the NIH's Office of Research on Women's Health. Our moderator this morning is Dr. Lucinda Maine, the EVP and CEO of the American Association of Colleges of Pharmacy, and I'm proud to say, a board member of Research America. Thank you all, leaders. We look forward to this.
Thank you, Mary. And my thanks really to the organizers of the forum this year for giving us an opportunity to talk about some things that we don't talk about very much. And we have an exemplary panel that brings a ton of experience from the public and the private sectors, and looking forward to moderating the conversation. Just a little bit by way of background. Over 50% of the PhDs that have recently been awarded in biology have gone to women. And yet, I think it goes without saying that in some respects, you all are an exception to the rule of women rising to important positions of leadership, regardless of our field, academia or industry or government. And when we talk about it, we recognize that there are some key issues that have blunted our ability to assume important positions of leadership. Some of those are related to work and life balance, but in other cases there are biases that we need to acknowledge and overcome. And so I'm looking forward to this conversation. As we prepared for it, what really struck me is that what we're really talking about is the importance of diversity, and in making sure that our leadership is as diverse as possible. And we'll come back to that with time. First two questions I'm going to ask everyone on the panel to respond to. And then I have some focus questions reflect your unique contributions to the panel. And so I just referred to the fact that our numbers, and in some cases our own experience, tells us that we still lack parity in science leadership in too many cases. And I wonder if you draw either upon your own career or those of the careers of others that you've observed to see if you can identify some of the key issues for why these gaps may persist. You want to start?
Absolutely. So, good morning, everyone. I think one of the key reasons for the gaps persisting is actually at the system level. You heard about over half of the life sciences PhDs going to women. In fact, for 40 years, women have been well represented in that space. The system has not changed, though, to catch up with the changes in the workforce. For example, promotion and tenure pathways have not changed. There are cultural issues around welcoming women and work-life balance and family-friendly policies that, although they exist, women feel stigmatized and unwilling or hesitant to use them. There are pay differentials that we know about as an issue as well. We do see that women publish less than men, and in different journals and on different topics. That has a factor because we talked about P&T, promotion and tenure, not changing. And then the advent of team science and the importance of collaboration being critical to science of today. Interdisciplinary research approaches are needed to solve today's problems. That requires a team. Our promotion and reward structures haven't caught up with recognizing those contributions, as well as recognizing mentorship, which is important, and we know that it is, but it's not rewarded. So these are some of the key factors that I see.
Thanks so much, Peggy.
Well, I'm going to be a little less scholarly, and thank you for framing all of those issues. And maybe I'll take the personal side. And you know, for those of us who have moved into leadership roles, the sort of responsibilities we have to be both role models and mentors. And I was very fortunate. I had a mother who was a very successful and accomplished physician, and she was a pioneer in many ways. And, you know, so I grew up thinking, you know, that of course I could be a doctor. You know, some of the best doctors and leaders in medicine are women. But But it was a shock for me when I entered medical school and my medical training and then the workplace that it wasn't as easy as my mother had made it look. And, you know, being able to assert myself, being able to, you know, really sit full square at the table, being able to balance the other pressures in life, because it was important to me to have a family and to commit time and effort to the family. And especially when I was in medical school, but as I moved through the system, how few other models there really were. You know, throughout my whole medical school tenure, I only had one female attending physician.
Wow.
You know, that was pretty astounding when I was in my clinical rotations. And in my residency program, there were only actually 3 women out of 35, I think. So that was pretty surprising too. But just one quick story, when I got to the FDA, and I was the second woman to be in that role, the first week, it was about 7 o'clock at night. I had 2 kids at home and a husband that actually was working in New York and commuting, so I was effectively a single mom during the week. I was leaving, and there were a couple of guys standing around in the hall, some part of the leadership team, and I made a joke, I guess I'm going home first. And one of them looked at me and he said, well, you don't have to say you're going home. You can say you're going to an event for work. And I said, why would I say I'm going to an event for work? It's important to go home. It's important to be with your family. And I knew that one of them had 2 young kids. And I said, and you should be home already. And so, you know, from that moment on, I really felt it was important to be a role model, that you could be in an important, powerful position. You could have credibility and impact, but you could also show that balance was important, and you could also admit that you weren't Superwoman.
Exactly. Thanks.
So all of the things you two have said certainly resonate with me, and I won't repeat those as factors. But I think the factors that influence whether women are in leadership positions or not, in general, are the same that I'm familiar with, which influence, you know, the fraction of women that are tenured faculty, full professors, which is, as you heard, although half the PhDs are given to women in this country in the life sciences, fewer than 25% of full professors are women. And I think this is a consequence of many factors, including the ones that have been mentioned by my fellow panelists. And the one I would add is that I think we are coming to recognize that the environment in which people work is a very important part of how they feel about their job. And there have been problems pointed out about work environments. In particular, there was, I think, a really terrific National Research Council study on harassment in the workplace, gender harassment. And I think it's quite clear from that study that this is really an issue that influences the retention of women in sciences. And so I think that is an additional factor. On a more personal note of how I got here, I think when I reflect on what enabled me to overcome barriers, I think for me the biggest influences were first that I went to a women's college, Smith College, as an undergraduate. And it had an enormous influence on me. I left there feeling like I could do anything. And I went to MIT for a PhD in chemistry. There was a single female faculty member when I started at MIT. But the feeling I got from 4 years at Smith carried me through that entire time. And really launched my career. And I think for many, many years after leaving Smith, I fell back on the sort of confidence and feeling I had that I could do whatever I wanted. And so that was, for me, a very powerful thing, in addition to having great mentors, as Peggy mentioned. That also was an important part of my success. And many of those mentors were men, they weren't women. But they played an important role in my career in supporting me and enabling me to get to the kind of position I'm in now.
Thanks. You've heard that often about women-only higher ed.
Yeah.
Yeah, very nice. Thanks.
So I have two stories that I think would help illustrate the value of, and I'm thinking about academia in particular, of what is considered important to succeed needs to be changed, and it will help all of us. It is not just changed because it will help women. It will help everyone enjoy their work more, have a family life that is reasonable, have a personal life that allows you to be someone other than a scientist. And I think that really needs to be done proactively. It can't just be, well, now we have more women, it will happen. It really needs to be thought of as a process, and what do we need to do to get there? And the first story is one of my first days at Columbia University, and I moved into my lab. I was very excited. My first lab. And the guy in the lab next door, I came into his office to introduce myself and say hello, and I noticed he had a picture of two children on his desk, and I said, "Are those your kids?" And the first thing he said to me was, "Are you one of those women who talks about their children all the time?" And I thought, you don't even know if I have a kid. I was talking about your children.
Oh, and by the way, welcome.
It's that, until we realize that's a value for all of us, it will not change. And the second part, and the second story is, I'm fortunate in that I have a husband who is not a scientist, who's in the business world. And he has been a mentor to me because he has heard me describe situations and said, "Well, why didn't you do this, this, and this?" And I said, "Oh, well, I would be too uncomfortable. That doesn't seem right. And he said, "The guys are going to think you're, weak. They're going to think you don't want it enough." And that discrepancy and understanding that is really important. It doesn't mean and I think it's really important that women don't become men. We need to have both, but that we need to understand that some of the things we may do may appear that we're not as driven or as interested or as aggressive or want it as badly. And I think I had this, and I don't mean to take up too much time, but I was recently at an LLS conference, and there were 5 men and 2 women who spoke. Every one of those men, although I only knew one of them, came up to me, introduced themselves, shook my hand, and thanked me for having them at the conference. The 2 women never approached me. Never approached me. And I know what they're thinking. They're thinking, "Oh, she's busy, she's the CMO, she's, this and this, I don't want to bother her, all the people are around her." It was so stark to me, and I said, "I know I've done that too." We have to take responsibility as wanting it badly enough to say, overcome those fears and actually self-promote. You need to do it.
Terrific. From the corporate sector.
Sure. Well, I'll start with a story as well, and it fits in nicely with what Gwen just shared. Maybe 5-6 years ago, I was attending the National Council for Behavioral Healthcare annual conference, and Hillary Rodham Clinton was the keynote speaker, and she was being interviewed by Linda Rosenberg, a very strong woman leader of the organization. And her kind of closing question for Ambassador Clinton was, "So tell us, what have you observed as a woman leader, over the 30 years of your career?" And she said, "Well, the takeaway for me has been Every time I've promoted a woman, she has said, "Are you sure I'm ready for it? Are you sure that I can do this? You know, can I make the grade?" Every time I've promoted a man, again, Hillary Clinton's words, not mine, he has said, "What took you so long?" I'm not running for president, so I really can't say if that's, at the time anyway. But I thought that it was exemplary of the attitude that I think many women have. Whether or not it's accurate for our male counterparts, I can't say for sure. But I only live my experience. But I will also say, with great thanks to the National Health Council, I have some good news to share, as we've talked about the lack of women in leadership across healthcare systems and certainly academia, and the opportunities for promotion. Among patient advocacy organizations, it's a very different story. So again, thanks to the NHC for this data, but of their voluntary health agency members, so non-corporate patient advocacy, consumer advocacy, and association members, 59.3% of those organizations have female CEOs, and 64.7% have female CMOs or CSOs. So I think the question is, what do we learn from these organizations? I was just doing a little kind of a survey across the room, and I saw Kim McCleary, and of course Mary Woolley, who has really been such a mentor to me and many others in this room. Nona Baer, Laura Gordon, who has taken on this challenge of starting a new organization, and to whom I owe an email. I know I will get back to you. And I think Amy Rick, so many of the women here who are inspiring leaders. In the patient and research advocacy community, I do think that there are lessons that we can learn there, and how do we extract those, and how do we bring that thinking over to all of our respective sectors. So
That's great.
So can I just say it is not easy following 5 very articulate women. It's really difficult to add to what's already been said. It all resonates for me. I come both from an academic background as well as now 20 plus years in the pharma industry. And I'd like to pick up on some of the nuances, and that is that there are decisions being made for us when we're not in the room that tie a little bit into implicit bias. So as an example, I am a career woman, and I also chose to have a family. And that then questions my commitment to my career. And so I have seen over the years, and even when I was in academia and in the industry, how these questions come up. And they come up in ways where we're not even there to defend ourselves. We're not there to say, oh yeah, I can be considered for that promotion. I can travel. I can relocate. Those are questions that don't necessarily come to us so that we're part of that decision making. I think there's another side to that, and that's that we as women, and I really thank you, Gwen, for putting it out there, we have to take some ownership. And there are some things that we're doing that don't help us in this case. So we talk a lot about work-life balance. We don't hear a lot of men talking about work-life balance, but they find it and they do it and they figure it out. And so one of the things that I have gotten a little more accustomed to is talking about choices that I have made along my career and along my life. And I think of my own life as being just one. It's not career, personal, my community involvement. It's really just one life. And all these pieces are really important to me. And the more we can get women to look at that in a more holistic way and to really think about how they find balance and not be really talking about that work-life balance issue that suddenly becomes a gender issue or a women's issue, and it really isn't. It's everybody's issue. We're all looking for balance. Is really one of those things that I'm still seeing, even though we've moved the needle. I still see it. I hear it in academia from my colleagues who are still there, and I'm still seeing it in the industry. So I think anything that we can do as leaders to make sure we don't fall into that trap, that we're not making decisions for women about what they can or can't do, especially when we're considering them for leadership promotions.
I have come to talk about that as work-life integration, not balance.
Thank you. Yes.
And you know, if you read the literature in the rising generation, the millennials, et cetera, it doesn't matter whether you're a man or a woman, that
right.
integration seems to be really key. Several of you have teed up the second question, but as leaders in our own organizations, if you thought about one thing that we should do that would help prepare the people who are coming up into leadership positions. And again, you've mentioned some of those recommendations, but why don't we go in the reverse order this time?
So I would say there are some things that when I reflect back to my own career, some things I wish I had done better. And I think that now when I speak to women in particular, but men alike in terms of my mentoring them, it's really about building a network and building it early. And then not thinking that you build a network and it's done. You have to continue to search and build that network. And I say this to my son every day. He just graduated from American University. The other piece is to find mentors and sponsors. And they're not necessarily the same people. I have benefited tremendously from my sponsors, and in particular in the industry. These are the people who have, when I'm not in the room, are able to speak on my behalf, and they're the ones that have opened the doors for opportunities. So I would give those two pieces of advice to prepare, and women in particular really need to be focusing on that.
I don't know that we think about sponsors. We always talk about mentors, but that's so important.
Sponsors, yeah.
Sure. So I'll speak to it from two sides. One is my primary organization, which is as COO of the Oshman household. And I look at our daughter, who we just dropped off for her freshman year in college, and I won't cry because it was only a couple days ago, who has from day one, really since 8th grade, she has said, I'm going to get a PhD in biology, in the biological sciences. I'm going to study wildlife conservation, and I'm going to figure this out. And really, I think that's incredible. And could I have said that at that age? I think I would have been more, to my earlier point, can I do it? Am I worthy? Can I get a PharmD? Can I go to pharmacy school? Can I do all of these things? So I think it is about, to your point, the generation coming up now doesn't necessarily differentiate, I should think this way, I am a woman. Yeah. So we, as those folks raising that generation, need to really try to get ourselves out of that rut. And the other thing I would say is fail. And what do I mean by that? I mean, if you fail at something because you tried and you took something out on the risk curve, you have a far richer experience than if you had sort of, instead of going for broke, you went for a little bit and gotten that success. So I don't know, I think about the number of times I have failed in my efforts to do something really outside the box, and I think that, I carry that double burden of not only failing, but gee, I'm a woman and will I get another chance? Get over it, because the only way you'll really learn is to fail, and so we need to show that to our girls.
An Einstein quote above my desk that talks about, if you haven't failed, you've really not ever tried anything important. Yeah.
I'd like to expand on that, because I was one of those girls who knew what I wanted to do the minute I took a biology class and said, this is it, that's where I'm going. But I think we also can suffer, and I don't think this is uniquely female, from thinking that you can just put your head down, do the work, be good at it, and people will reward you. If you've had a nice family who has rewarded you when you do a good job, you think that that's going to continue. And I think we need to be proactive, and I hope that young women don't believe that the problems are all solved just because the men may be more evolved about life balance in the next generation. I don't think that's, we need to be understood as wanting these careers and wanting to do this work. And finding those mentors. And it's not, for me, it was never comfortable to ask anybody for any help. And so I think I harmed myself in my career in doing that, and I really encourage people to do exactly as you said, to build those networks and to be proactive about saying what you want and where you hope to go.
Terrific.
So I think all of the things that have been said resonate with me. And I guess I would turn this around a bit and say that although it is important to give women and actually others advice about how to succeed in science, I think that now equally important is for us as leaders to focus on changing the environment of science so that people from all different walks of life, gender, ethnicity, race, are in a good position to succeed. And that is not the case now, right? We have serious issues, I think, about bias that we've talked about harassment, that really we need to clean up. And I think people need to be educated. Leadership, but also scientists need to be educated about creating inclusive environments where everyone is in a position to succeed, who is talented and wants to succeed. And I think this can clearly have tremendous influence. So at HHMI, it turns out that many of our investigators, they train a disproportionate share of the next generation of faculty members at the top research universities. And so now we're beginning to focus very much on how to create inclusive environments in those research laboratories that then go on to train the next generations of the professoriate. And in doing so, creating those kind of environments will, I think, have a significant effect on the number of women who go on in science and the number from other groups underrepresented in this area. So my message is that a good part of what we should be doing as leaders is focusing on cleaning up the environment.
Peggy, I'm going to insert, because we were talking as we were preparing to come up, how pleased we are to be participating in the AAAS-led effort on these issues that just were teed up. Would you like to say a little bit more about that?
Sure. I mean, I think, building on what Erin was just saying in some of the earlier conversation, it is really a critical time that we really focus on how do we change the culture of scientific research institutions and other science-based organizations, whether it's industry, government, or academics, and that we really have to recognize that it's not just flagrant sexual harassment that's a problem, but it's the sort of constant corrosive joking and teasing and in the Academy report they refer to it as gender harassment, but that it's really it's the sort of quiet, unstated, I think, one person commented on this, assumptions that, well, you're a woman, so you're gonna leave the lab and have babies, or because you've got kids at home, you can't travel, or, and even now, I mean, I think this is a worrisome aspect of the light that's being shown on sexual harassment in the whole Me Too movement, that now you hear stories that, lab directors or agency heads are unwilling to take a woman with them to a conference or have a mentoring lunch because it might be misperceived. So we've got a lot of hard work on changing the overall culture, and this will be good, going back to other comments made, not just for women, but for appropriate inclusion and equity and diversity, which will not only enhance the lives of individuals and their career paths and opportunities, but it will enhance the robustness of science done at these institutions and the esprit de corps within these organizations. And you mentioned about AAAS. AAAS is now very involved. I'm chair of the board at AAAS now, and we've launched a program that's actually modeling on a successful program in the UK. But our program is called Sea Change, and it's really working with academic institutions to really ask hard questions about these issues, about the culture within their institutions, and how they're actually performing on some key measures. Develop a strategy to address them, based on information about what has worked in other places and based on their own assessment of needs, and then to really monitor progress, but to be held accountable. And it's almost creating a framework of assessment and ongoing improvement and evaluation that's like the system that now exists for environmentally sound buildings, the sort of LEEDs rating, and so your institution, can get a platinum rating if you work hard and make it a priority. But it's really, trying to identify the nature and scope of the problem, not in a way that's punitive, but in a way where you are going to be held accountable and where there's going to be ongoing assessment and where there are going to be rewards and hopefully resources that go with that for constant sustainable change, because we all know you don't change culture overnight. It is a process, but it's something that you have to really be committed to, and you really have to have signposts for progress.
You have to measure what matters.
Yeah.
Right? You co-chair the NIH working group on women in biomedical careers, and it strikes me that that's a purposeful effort to add value in this portfolio.
Absolutely. So the NIH Working Group on Women in Biomedical Careers was created after the 2006 Beyond Bias and Barriers report that the National Academies put out. And at that point, the then NIH director, Ilya Serhouni, challenged the ORWH director, then Dr. Vivian Pinn, and to develop strategies and not have this be a report that sits on a shelf. That working group worked through committees at NIH to develop family-friendly policies, extended leave, maternity leave for fellows, added stop the clock provisions, added a keep the thread provision for postdocs to go down to part-time and not lose their health insurance and not lose their NIH status. A variety of other, a leave bank where people could share their leave with others, so those types of policies. But one of the biggest things that working group did was, for the first time, NIH supported grants to actually study the factors that are associated with women advancing or not, and to test interventions in a very rigorous way, like you would with a randomized controlled trial. As a result of that $17 million investment, now there are over 100 publications from those principal investigators who've banded together and formed a grassroots group called the Research Partnership for Women in Science. We now have evidence about what works for some women in some contexts. And we know that the array of factors, we have the data to say culture is important, but there are ways to measure it. There are validated instruments to measure culture and climate. So you can measure it over change with sea change or any other intervention. We also now know that you can't probably just do one-off interventions in one part. You need to look at this from a socio-ecological model and look at the individual, the institution, broadly academic, and I would say the entire biomedical enterprise, including pharma and beyond, and develop coordinated strategies. Not that we, among this panel, could actually coordinate something quickly. We have a lot of barriers between us, but we do have a lot to learn from each other. And so now what we are doing, coming up in November, the National Academies, we funded a consensus study to look at which interventions work for which women and why they haven't been adopted more broadly. Because we have the evidence. You heard about putting science into action earlier today. We have evidence of what works.
We're 17 years from discovery to implementation, right? We don't have 17 years. So now I'm going to target specific questions to specific panelists. And Erin, I'm going to start with you.
Okay.
It's okay. It goes back to the fact that while we have the enrollment of equal numbers of men and women in the biomedical sciences graduate schools, only 22%, I think you mentioned that, are tenured full professors. You've done some things at HHMI to increase diversity. Do you want to just share some of those?
And this is a perfect segue because when I was Chief Scientific Officer, I helped to design a new program called the Hannah Gray Fellows Program that I'll talk about in a minute. But the design of the program was informed by the studies that you mentioned, Janine, about interventions that help retain women in science. Okay, so that's the first thing. And so let me just say, so the purpose of the program is really to enhance diversity in the professoriate. That's the ultimate objective. And we are targeting the career stage after the PhD, which, as we heard, 50% are given to women in the life sciences. And there is a loss of women at every career stage thereafter. And so this program selects people right at the end of graduate school and provides 4 years of postdoctoral support and up to 4 years of support as an independent faculty member. So we invest more than about $1.2 million in each one of these people. We will appoint our third cohort. They're called the Hannah Gray Fellows, as I mentioned. Hannah Gray was a tremendous HHMI trustee, but also one of the first women presidents of a major research university, University of Chicago. And at any rate, the program is named after her. And we do a lot of things in addition to the financial support. So we help the group build a cohort. We have training for the mentors. We have discretionary fund that can be used to pay many expenses, but including childcare expenses through the entire 8 years of support. And as I said, this is the third cohort that we're now appointing. And I can tell you that it is remarkable to see the people that we get for this kind of fellowship. It makes you realize that there are many, many talented people out there. And I think even a modest-sized program like this, we appoint 15 people a year, can have a significant effect on diversity in the professoriate, particularly for underrepresented minorities, but also, I think, for women. And so, yeah, that's it in a nutshell. We also have other programs targeted at other career stages, the PhD with the Gilliam Fellows, but this Hannah Gray is something I wanted to highlight.
That's wonderful. Peggy, we know that the pipeline to get people prepared for that has to start very early. And another AAAS program is the IFthen program that targets middle school aged girls in STEM.
Yeah, well, I think this is very important, and I think, you know, we've been focusing on women once they're, you know, sort of in the workplace and the barriers and opportunities they may see before them, but we want to make sure that we're getting, you know, as many people as we can, as many, you know, girls interested in science. And again, it's not just, you know, looking at girls, it's looking more broadly at inclusion and diversity. But we need to make sure that we have the pathways, and this is a program that's specifically targeting middle school girls and connecting them up with mentors in the STEM area. And I think that that's a very exciting opportunity and a chance for people that otherwise might not have quality STEM education in their schools to be exposed to science, to be excited by science, to see what's possible, and to get, you know, real support as they expand their interests and try out new things. So I think that's really important. But I think the broader issue of really making sure that we are not forgetting about the importance of reaching kids early and providing the appropriate education. I mean, in the modern era, everyone should be fully exposed to science and technology and math education. And especially if we want to look at where we're losing women in the system, you know, we lose a lot early on because there isn't the perception that they can do science. And And it continues on. I mean, I have to say, just going back to a personal story, I was sort of shocked. My daughter, who's now 26, and she's on a great career path. She's a third-year law student at Yale. But she said to me, Mom, I really think if I had had a better science teacher, biology teacher in high school, I might have done science. And I felt like, number one, I let her down, but that was pretty profound. So we need to not forget about the importance of early exposure and early education.
I think the Girl Scouts are stepping up their game in the area of STEM, which is terrific. Michele, you mentioned in your opening remarks about the role of women leaders in patient advocacy groups and the things that we need to potentially learn from them to extrapolate beyond. Can you just talk about that a little bit more, and then specifically what Lilly does supporting women in leadership?
Sure. I mean, I guess that it's a timely comment. Certainly, I think about the women who I look to as mentors, Amy Rick being one of them, who leads FDLI, Mary, of course. And I think the lesson to learn, 60% of senior officers at patient advocacy groups are women. This is a big deal, right? In my observation, my non-scientific data collection effort, is there's collaboration across the patient advocacy community that I feel fortunate that I get to observe every day. Certainly, groups are vying for grant support or any number of things, but in reality, they come together around advocacy. For example, advocating for everything that certainly we talk about here at Research America, advocating for access for patients. And I think patient advocacy organizations do a good job of amplifying one another's efforts and messages. And I wonder how we can do that. How do we extrapolate that and bring that forward to other organizations? At Lilly, we're in the business of drug discovery and development. So we approach everything from a scientific perspective. That's good. You want that for medicine. And so similarly, we undertook an effort actually in 2015 to do some rigorous data collection around women in the workforce. And I think it certainly it has been a long-term effort and a long-term project. But some of the key findings from this data collection initiative, 47% of Lilly's global workforce in 2015 was female, but 52% of entry-level jobs were held by women. And so how does that imbalance happen? What do we need to understand from that? That same trend line went up all the way to the executive suite, where we only had 20% of our executive level employees were female. Certainly, you can't approach something like this with a Band-Aid, so it is a long-term culture change that our CEO has had the courage to really bring forward. It has involved a number of interventions, behavioral interventions, as Dr. Clayton referenced, and really better understanding how to create that employee journey so that everybody feels safe in their environment, psychologically safe, but also safe in having the conversations about their career. Certainly, I've been here at Lilly for 17 years. At the beginning of my career, I'm not sure I ever would have asked the question, what's my career trajectory? And I'll take 2 maternity leaves in the meantime, so I hope that's okay. I mean, so I think making every conversation around career development planning safe and constructive, and really holding our leaders to that. And so there has been a very significant interventional effort, including workshops, training, ongoing dialogue, and we really have seen a very significant, we've measured the change. So last year, 60% of our promotions for women, for senior director and above went to women. And our executive committee is now much more balanced. So we hope that that trend continues. Again, not just to populate with women for the sake of it, but because she's the right person for that job. And how do we help make sure she's the right person for that job? How do we develop and engage that employee from day one?
There's that measurement thing again. Gwen, your society conducted a poll for public views on the role of women in cancer research specifically. 8 out of 10 adults polled believe women are critical to science, and 7 out of 10 believe more women should have leadership roles in science. Can you talk a little bit more about the survey?
Well, we decided to commission the survey because we wanted to take a good hard look at ourselves and our practices and what we were doing. We looked at some of our grant review panels and saw that they were populated by the same guys. And while they are brilliant scientists, it was a catch-22. We never seemed to change and have a diverse group of scientists. And so this wasn't, the survey was about women, but we wanted to look about diversity and how we did that while keeping the quality of the scientific review. And so we actually asked 1,000 adults, 50-50 men and women, and very diverse around the US, these questions about what do you think about women in science? Where should we intervene? And most of the answers were about young girls, and if you can't see it, you won't be it. So we took 2 steps. One of them was for our panels to proactively look at our grants, because our grant recipients, interestingly, are quite diverse and are quite even in terms of their backgrounds and their genders. And so, but oftentimes there were big grants where the leader was a male and 1 or 2 of the key components were being performed by females. And when we saw great performers who were still young and weren't yet, at that level where we are going to pick the highest level person in the department to be on this committee. Instead, we said, let's pick some of our really great performers, because the only way they're going to be recognized to become a leader is if they have the opportunity to be on these panels and to be introduced to other people. And so we made a conscious effort to do that on our review panels, and I think our panels are much more diverse. But the other piece was we looked at our programs that we have in schools, and we have a program that's called Pennies for Patients. And it's a program where in the schools, kids raise funds and learn philanthropy. And it's meant to be, you go home and do chores and your parents will give you pennies to put in the box and bring to school, and that goes to science at LLS. And what we added to that was a STEM curriculum in the schools. And these are kindergarten and elementary school kids. So we have stuffed blood cells, and we talk about kids who may have to leave school because they have cancer. As you know, ALL in children is the most common cancer, and these kids are usually kindergarten age. That's the peak. And so a lot of these kids experience it, and the teachers need to be taught about how to reintegrate kids after they've been treated. So we built a big curriculum around that, and we also made sure that the pictures and the cartoon character of Dr. Nichols is actually a female, so that they see a female doctor in the video, and they learn about the blood cells, and we hopefully make it exciting so that this is a win-win, and I think it's been a successful program so far.
So we were going to stop with where are you seeing the bright spots on the horizon, but many of you have mentioned that, and I have a feeling that there might be a few questions among the audience for the amount of time that we have remaining. So the only other thing I want to say is, wouldn't Dr. Collins be really proud of this panel today? So there, I see one in the back.
Is there a microphone?
Yep, in the front.
Hi, my name is Erin Mertz. I'm director of the Aspen Institute Science and Society program. First, I want to commend the organizers for putting together this amazing panel of leaders, not just women leaders, truly inspiring. In a discussion that largely centered around obstacles and barriers. I would love to hear a few examples or anecdotes of moments when your gender was an advantage or an asset in your career.
Well, you know, I have to say it's a little bit negative, but there certainly have been times when people's expectations were lower because I was a woman, and then I was able to surprise them.
I have to tell one story. I was on a committee one time, and there were 13 people on the committee, and I was the only woman on the committee. And another group was out later in the evening, and we were socializing, and somebody asked me about my committee experience, and I said, well, you know, could you believe it? There were 13 people on the committee, and I was the only woman. And he stopped, and he looked at me, and he says, you know, Lucinda, when I work with you, it doesn't occur to me you're a woman. Herb? Yeah, microphone coming.
Well, first, I want to thank whoever put this panel together because this was a great conversation. And I want to address my comment to two, but I think almost everybody said something like this. I will tell you, as a child growing up, I found the behavior of some of my male friends and colleagues extremely disturbing because I found it denigrating toward women and escalating for men. So my question is, number one, is there a value in trying to have more of a focus on that early development, which creates this kind of attitude in men versus women? And if so, is there somebody doing it? And if not, what should we do?
Anything coming out of the trials?
Well, so most of the trials focused on the professoriate, so they weren't at this level. But I certainly, I don't know if you've heard this expression called, my mom calls it home training. You know, it's manners. It's basically manners and how we behave. We don't behave that way. And so you're talking about early, right? Very early. And so that's part of who we are as a nation. It's part of work that we need to do within our schools, I would say. I don't know if it's even part of the program that, the IFthen program, but that's I can pivot a little off of that to say that male allies, let's see, those folks that grew up, are very important for women, and men who are sponsors and mentors are very important. And we are seeing people step up in amazing ways. Sometimes it's very visible publicly, sometimes it isn't. That sponsorship can often happen behind the scenes. You know, that person would be good for that. So hopefully, within their homes, if we are not within our schools, you know, the millennials that are having kids now who are different, there are real generational differences, will be raising kids that won't behave that way.
I have two men out right now on parental leave, and I'm proud of that. In the middle?
Okay. I'm Kristen Carmen from the Patient-Centered Outcomes Research Institute, although my question is more as a parent. I found this conversation fascinating, also someone who got a PhD herself. I watch my daughter and her middle school students, and even in real time. What I find fascinating in terms of engagement with science and math is the girls take a much more collaborative approach. And they don't so much like gamification, that is competitive gamification. So I find that, I wonder, as you think about women throughout the trajectory of the science trajectory and the STEM trajectory, what role this plays. For example, if our examples are about race car driving for a physics versus some other kind of example. If the discussion is whoever does best gets a reward as the individual for the best talk on a science project, I suspect this has reverberations, but I wonder what you see not only as the consequences of that, but then how do we sort of tip that so that it feels like a more, not just engaging, but for the way girls and women see the world as much more important, whether it's the environment or other kinds of things. Thank you.
And someone's mentioned team science and the emergence of team science, and I think that really folds into that
That's
query.
what I would say. The emergence of team science is really resonates completely with your comment. The field that I would also mention is global health. The number of undergraduates who are global health majors has skyrocketed, and many, many, many of them are women. NIH supports, with the Fogarty International Center, graduate students and other students. Half of those students are women. I talk to them every year. So that's another area, and they work on problems more collaboratively. So we do need to find a way to reward teamwork and not say it's only who's the lead on that team, who really is the lead, because we know there are issues around publishing as well, 25% of the authors, typically first or last author of the senior positions, are held by women. You heard the stats earlier, I'll give you one more. Not so good as in the patient advocacy field, 5% of STEM chairs or deans are women, 5%. So, that's from 50%, and we see 50% parity over parity in most of the PhDs for 40 years. So it's been time for the pipeline to be full. It's not about the pipeline, it's about the system. And you've heard about some amazing potential solutions. Last comment, it really has to come from the leadership. Change has to come from the leaders. I see my colleagues agreeing with that. And recently, you mentioned, I don't know if everybody knows, that Dr. Collins came out and said that, no more Manels, that he would not be willing to speak on a panel that did not have appropriate diversity. And it's reverberated. I think we've got a lot of attention. Other NIH leaders have also pledged that as well.
It's terrific. In the middle?
So this is probably more of a parenting advice thing. I'm a father of 4 little girls, so your panel has been extremely inspiring and instructional for me. But I would love to hear how fathers might be able to play a role in the successes that you all have had.
I'm happy to speak to that. We have a 50-50 balance in our household, so a daughter and a son. I think that, and I have to give my husband kudos, he's the youngest of 4 and the only boy. So when my friends talk to me about if someone they're dating or whatever, I'm like, marry someone with older sisters because he'll get it. But I think similarly in your situation, right, 4 little girls, what can you do? I think fostering that sense of curiosity, and don't be afraid to take them for a hike in the mud in Rock Creek Park and look for salamander eggs, right? Don't shy away from doing things that might be icky or dirty because they're girls, right? And I think don't assume, I'm not suggesting that you do assume this, but when my kids used to play together with dinosaurs, my daughter was having all the dinosaurs do a tea party, and my son was weaponizing them and trying to, completely crush her animals. Recognize the play style is different, but I think don't be afraid to introduce what might historically be considered, male play. I think to how boys play with each other. Just think about how do you introduce stuff that they're interested in, that they will eventually become good at. And I think the biggest thing is, my husband was never, we were never afraid to just take Judy through a muddy creek and look for, whatever gross things we could find and look at them under the microscope in our living room, because we're geeks.
And it's okay to be a ballerina and a scientist.
It's
okay.
I was going to say that the flip side of that is don't be afraid to dress like a princess.
Yes.
And, do tea.
You're the prince.
I just got the wrap up. I knew that there were going to be more questions than we could. I had more questions than we had time to cover. Would you join me, please, in congratulating this outstanding panel?